Hi, I'm Lauren Massey, physical therapist and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about caring for a meniscus injury with physical therapy. So to get started, what is the meniscus and where is it located? The meniscus is a type of cartilage that we have in our knee. I'm going to move the kneecap away, which you cannot do on your own, but if I bend the knee, between our thigh bone and our shin, we have these two kind of circular areas of cartilage in there, which act as spacers for the knee joint and kind of deepen the socket a little bit to give us some stability. So how can you injure your meniscus? Well, menisci can be injured through twisting and pivoting injuries, where we kind of shear and cause little tears in the meniscus, or it can be overuse, wear and tear, where it's more of a fraying type of injury. Depending on where your meniscal injury is, can contribute to how well it may or may not heal based on blood flow and the type of tear that you have. One of the things that we're lucky enough to have here is musculoskeletal ultrasound. Now with musculoskeletal ultrasound, I can see the outer edges of the meniscus and I can assess whether I'm seeing swelling coming out from deeper within the socket. If I am suspecting a deeper meniscal injury, I might refer you back to your doctor for an MRI so that they can look more deeply at the center part of the joint and the type of tear there. Sometimes if you have a flap tear, where that meniscus can literally flip back and forth, you might notice some catching or locking in the knee. Sometimes those do require surgery. I would say more often than not, that type does. If it's a small tear on the edge or some of the micro tearing and fraying that we see more commonly in the population, there is a clean out surgery, an arthroscopic surgery where they go in and kind of just shave things down, that is offered. But again, we often don't rush people into that type of surgery. We want to start with conservative care first. Some of the research out there shows that those clean out surgeries are not much better at about a year out than conservative care for those types of tears. Definitely a conversation to have with your physical therapist and eventually your doctor if needed. Going back to the conservative care approach, coming to physical therapy on evaluation day, we're going to see, through poking, prodding, testing, moving, some strength mobilizations, watching how you move, kind of see where your biomechanics might be off that could have contributed to your particular injury. And we're going to talk to you about if it was a traumatic injury in a sport, for example, which way did you get hit, so we can kind of determine where we think this internal injury might be. Based on what we find is going to develop our program. Do we have to work on retraining biomechanics? Do you play a jumping sport and you landed funny and those knees maybe fell in, which created a weird torque, which might have resulted in this injury, which will then let us know, hey, maybe we have to go up and strengthen your hips a little bit. We might look at your feet and your arches and the type of footwear that you use. Allowing the arches to fall in does then cause the knee to kind of bend sideways a little bit, and you might get more compression on one side of the joint than the other due to the biomechanics of your feet. So physical therapy is going to look above and below, not just at the knee, to again try to make sure we get you back to function fully as quickly as possible by strengthening the areas around it and to decrease stress on those healing tissues. We also have a class 4 laser that can help stimulate tissue healing, decrease inflammation, and decrease pain. So again, our job is to help you get back to function as quickly and normally as we can. And then if needed, if things aren't progressing the way that we expect, we might refer you back to your doctor to discuss if there's any other injections that might be helpful or worst case scenario surgery. If you would like more information on our class 4 laser, please see our vlog entitled How a Warm Healing Laser Can Improve Physical Therapy Results. So we hope to help you on this journey for healing your meniscus injury. If you have any questions, please reach out to a physical therapist today. Thank you.